The reason the bioidentical hormones I prescribe work is because a few things. One of them, I've been doing it for 15 years. But before that, I've been a doctor for 35 years. And so I have learned to listen, and I've learned to understand the human body. I'm also a pretty decent researcher. And what I've done is really research everything. I don't just cavalierly give people things on say-so. I do my research. And then I realize that I'm only as good as the last patient I've made well. The fact that I've taken care of 20,000 people and they're doing great on bioidentical hormones doesn't mean anything to me if today's patient doesn't do well, if you don't do well. So I work with individual estradiol, progesterone, testosterone, in general, these three, and thyroid. Thyroid is huge. And the more I've been working with hormones, the more I realize that everybody probably needs thyroid at some point in their life. And creating the proper balance is more art than science. But the science is very important. And following the science and listening to the science and understanding the science has helped me deliver a form of art to my patients. What they call magic, and you know, the beauty of what I do is that every day people come in and say the same thing. It's magic. I feel great. And I am a person who lives off of people, you know, people's doing well makes me feel good. And I've been doing it myself. I've been taking bioidentical hormones for 15 years myself. So I understand when they don't feel well, what it feels like. Because I've experienced probably 90% of the symptoms that people come in with, suffering with them for decades for no reason. So I've learned to separate the hormones out and then to give them to the person in the balance, the ratios that's appropriate for them. And above and beyond everything else is I listen to the patient. So I don't think I know it all. After a month, after 2 months, we talk, we rebalance, we tweak, and then eventually the patient becomes the boss. The patient tells me, this is what I've done to achieve the results that make me happy. And you know what? With the patient being in charge, it works better than any medicine I've ever practiced, short of running the trauma center where the patient wasn't in charge, fortunately.
Good.